Hi, I'm Viv, and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. Tonight I thought I'd continue with my series of lives looking at the use of facial ultrasound scanning. And tonight we're starting a series of lives with Dr. Sunny Dhesi, who's a friend and colleague who I've known for a while now. So I'll just add him on. There we go. I'll let Sunny have a few words to say. Are we going to join up soon, Sunny? Hi.
Hi, Viv. Is that working?
Working fine, yeah. How are you doing?
Yeah, good. I raced home. Are you still in clinic?
Yeah. Because I've got a clinic from home, so it's easy enough for me to get back into the clinic.
Good.
But
No, I raced home. So I finished I think 10 to 8, 8 o'clock, and then I got home. But no one's at home, so I was like, well, where is everyone?
right.
So I've been ringing.
Quiet night.
So I'll get interrupted now by a phone call saying where they are. But
Right.
anyway, it doesn't matter. It's
Well,
fine. Go on. I
yeah,
heard the introduction, so after you.
yeah. Well, as I was saying, I've known you for a couple of years now, mainly because of COVID more than anything. And we've both been doing our aesthetics work. And one of the big topics in aesthetics now is the use of ultrasound scanning during the work we carry out. So I thought we'd talk about it. And we're thinking of starting a series of lives every week over the next few Thursdays to talk about our own experiences of using ultrasound in our work, how we got into it, what we think of it, and what we plan to do with that technology as well. So we're going to keep it short. It's not going to be the usual hour-long recording. We'll keep it to about 15 minutes or so. It'll give viewers an idea of what we're talking about and what we'll be talking about in the future. So it was really just to say thanks for joining me, and I'll probably join you next week when you host the live yourself, Sunny. So we've both been working aesthetics. I work up in the northeast. Sunny works at his own clinic, Vysana, in which part of England is that?
East Midlands.
East Midlands,
So yeah,
right?
so in Rutland, which is a small county next to Leicester.
Yeah, great.
You need to.
So as I said,
It's the smallest county in the country, so you'll be like looking, and then that's where it is when you look on the map.
well, I'm sure you're the best aesthetics practitioner in that place, in that area.
I'm sure. Yeah.
But we'll go through a few topics. This is just a short introduction to do with our lives. We've both been working with an ultrasound device for the last, well, I've been using it for probably about 3 months or so. I use a Clarius L20 HD ultrasound scanner, portable, wireless, rechargeable battery, and I can use it for all sorts of aesthetics work that I carry out. You've had yours for a little bit longer, have you, Sunny?
Well, okay. For open transparency, I have had it for longer, but you probably used yours sooner than I did. So
right.
classically, I bought it. So I guess one of the things that maybe people are watching is that, well, you bought a new piece of kit into equipment, you invested in it. So, where did the journey start? And I had made some notes just to make it easier. So we kept it structured rather than going off on a tangent. But I guess where we start off with is, why did I choose ultrasound to invest in?
Yeah.
And I invested in it, I think it was November, December of last year. It did stay in the box for a while, probably a couple of weeks, and I think it was your prompting about how am I getting on with it that it prompted me to get it out. And it was a little bit of a fear because I spent so much money on it, and then I was like, I'm not quite sure how I'm going to utilize this. But over our conversations, we have kind of reflected on what led us to this investment. So to make this entertaining, I'm going to just use some wild analogies. So I equate ultrasound right now to like cryptocurrency, right? Everyone's heard of ultrasound and everyone's heard of Bitcoin. but the majority of people will be like, Bitcoin, cryptocurrency, that's not for me. And in aesthetics, I get that same impression. You could speak to 10 people and maybe 50% will say, yeah, but why do you need ultrasound in clinic? It's, you know, just like the doomsayers for crypto. So yeah, what's the difference between ultrasound and crypto? There's no difference. They're both important. But in terms of, I was going to ask you to just structure this a bit better, is why did you want to invest in ultrasound? Like,
I'm pretty much into all forms of technology, and I've been interested in technology for years as a student, as a practitioner. And for me, I came about it by accident about a year ago when I saw a webinar by a doctor called Dr. Leonie Schelker last year. And she was taking part in an ultrasound webinar on behalf of CMAC, who we're both members of, complications group. And she was talking about the use of ultrasound in diagnosing problems, particularly in facial aesthetic complications. And for me, that was just a game changer, hearing about what could be done with a technological device like that in our own work, and the work that I do with dermal fillers in particular. So I looked at the devices that were available. I spoke to a few different individuals that were providing information about the device. I spoke to Leonie, I spoke to Tom van Eyck over in the Netherlands, and I ended up investing in a scanner myself earlier this year, and it was for the purposes of improving patient safety more than anything. But the other reason is we hear a lot about practitioners using a device like this, but individuals don't always get to hear what it's like for us in our own experience of using the device. You know, how do we find it? What can we do with it? How difficult is it to use? And I think the reason for having these lives was to give our own experiences of using the device and what we'll plan on doing with it.
That's a really good point, Viv. So I think the first question is, if you're and we'll kind of make it generic. So if you're investing in a piece of kit, so if you want to invest in a piece of kit in clinic as an aesthetic practitioner, as a, you know, if you're running a clinic, what is the reason? So the reason for me, and I think the reason we discussed this, was that I want to invest in a piece of kit that, improves patient safety, improves my ability to inject better, and also in turn increase value that I'm delivering in clinic. And the second question is, well, how do I do that? So how do I improve patient safety? How do I add more value for my patients in clinic, especially in the injectables front? And how do I improve my ability to inject? Well, I'm going to invest in a kit that helps with injectables, which is ultrasound. Now, I remember our conversation about which ultrasound to invest in, and I think this is where we differed a little bit. Do you remember how you were going to approach it?
Yeah, it's difficult in terms of, it's an expensive piece of equipment. They're not cheap devices. And there is more than just the Clarius around. There's other devices available. GE make a device, Philips make a device. It was really to look at a device that could give me exactly what I wanted. I wanted to use a device that would benefit me, it would benefit my patients, but also I could use it with other practitioners. And one of the reasons I use this is because we can share information together. The other devices may be possible in future to do that, but currently the Clarius is used by a lot of practitioners. There's a lot of experienced practitioners using the device. And for me, I found it more beneficial to know that something like this is tried and tested. So I chose this after speaking to you, knowing that you bought one already.
Oh no, I feel bad now, because I only bought it because they said you get free battery and holder with it. I'm joking. We did get free battery and holder with it anyway, but no, exactly that. So you did your research, Viv, on this, and I think at Sorry, I've got to pause on my battery's low. But I looked at the Clarius, and I looked at the others, but it was the portability, it was the software integration, definitely. And then there's a lot of, there's a wealth of information out there. So Clarius have got a really good website with loads of videos, and it's versatile use. Like, I think there's videos on there for veteran vets, for orthopedics, for joint injectors, for obstetrics and gynecology. I thought if it's such a versatile device, it's probably going to fit very well into, like, both of us are holistic practitioners. It's going to work well because yes, it's for facial aesthetics, but we can use it for other things. So that was like, why would you choose this piece of kit to invest in? And then I guess the second, for me, it was, where was I at in terms of my story, in terms of injectables? So I've done loads of training, as have you. So it was like, well, maybe I'm not as confident as I want to be because of the risk of complications. Because of the risk of complications, then does that inhibit my ability to be the best injector? So possibly I'm worried about visualizing certain areas, and then that limits my ability, and again, the effectiveness of what I'm doing. And then perhaps I just wanted to differentiate myself from other, other clinics and practitioners, and by innovating. And what about for you? What was it? What was the kind of not negative points, but kind of where were you at before you had? I
was Training's an important part of aesthetics practice. You need to practice. You need to train ongoing. You can't just train once and that's it. You need to carry on with training. But despite all the training that you do, there is no guarantee in injecting. You base your knowledge on reading, on anatomy, on experience, but ultimately we cannot see what we're injecting. We can't see under the skin, and that's always been a problem. In the early days when I first started, I used to have sleepless nights worrying about whether I've caused a problem by injecting filler in the wrong place or used the wrong amount. And in terms of improving not just patient safety, the benefit of this device that I've wanted was to make things easy for me as well. Psychologically, carrying out injections isn't easy when you're worrying about them all the time. And having a device like this can, in my experience now, make work easier for me. I feel happier and more confident in being able to inject dermal fillers in particular by using a device like this. I'm not saying I was completely hopeless before using this, but what it has done, it's helped me feel more confident and give me an extra layer of security that I prefer to have. So the reason I chose the device was because it was available and was able to make my life easier in terms of safer patient treatment, and also making my sleepless nights less worried, having less worry about them.
So I think possibly where most practitioners are and where we were was that you can inject, but if there is a complication or a problem, it might not be immediate. But how do you, when at that time when you have a lump or a swelling, and as healthcare practitioners, we all know what's available to us, but we just couldn't do it in clinic, and then we have to refer, and then you have to network, and obviously that's not always easy, especially as sole practitioners. You're running a clinic by yourself, so possibly, perhaps, maybe you're at a situation where I'm worried about injecting because then I might end up with something that I can't visualize and sort out. And then, where do you want to be? Where did we want to be by having ultrasound? We wanted to be able to help visualize the problem. So if it's a lump or granuloma or swelling, we can visualize it and then potentially diagnose it and treat it. We wanted to envisage a time when we're confident in injecting. I mean, like you said, clinically you can assess, but there's that extra safety layer that you've got. And also, again, it brings you to a time when you are different to other practitioners because you're innovating in something that just seems to be tried and tested. It's tried and tested technology, as opposed to just playing it safe and just injecting. Innovating in your clinic trying new ideas. You know, fine, you know, we could have invested in a piece of kit that just didn't add any value, but we both know as healthcare practitioners that it does. So
it does. There's also efficacy in terms of like assessing efficacy of treatment. We're basing it on how somebody looks, and that isn't always the only thing that we need to do. Somebody can look great after a filler treatment, but there isn't a guarantee that the reason they look that good is because you've injected in the right place. And something like this scanner can show us exactly where a filler has been injected. It can help us with guided injection. We can actually see as we're injecting exactly where the filler is lying, how it's spreading once it's injected. And that's one of the benefits. If we know we've injected in the right place, we're more likely to cause less problems, and we're more likely to see a more beneficial outcome for the patient at the end of the treatment for an ongoing period of time.
So we've kind of spoken about where we were before we had ultrasound. We've kind of discussed like why we wanted to get ultrasound, and obviously why we chose the Clarius.
Yeah.
Where we were, where we are now, where we want to be, and obviously innovating. So I guess, why is it important to have ultrasound in an aesthetics clinic? So why is it important? Why is it so important now?
In terms of use of the technology now, I use it to assess, to vascular map all of my patients, whether it be dermal filler, toxin, or other patients. I pretty much use this in every patient that comes in to see me now. It gives me practice in assessing different parts of the face. It gives me experience in carrying out certain treatments for those patients. And the benefit for me is it helps me carry out my work more easily, more safely, and it gives me the ability to worry less about what I'm doing. So safety is one issue. It's important because it's improving safety for the patient. It's improving efficacy for the treatments I carry out. Patients are happier because I'm using it, and they think having technology that makes the treatment safer will benefit them, which it will. And also it lets patients be more confident in your abilities, not just in the treatments you're doing, in other treatments they may be thinking about. They can see that you've invested time, money, and energy into looking after them. And because of that, they tend to be more confident in your abilities and my abilities.
So do you think, as in the wider picture, so why is it so important now? Do you think that, for example, in a year's time, insurance companies will start to be insisting that if you're an advanced injector, you've got to actually be trained in ultrasound?
I think the benefit of ultrasound is easy to see for any injector, and insurance companies base their fees, the amounts they charge us for on the safety and the danger involved in carrying out certain treatments. With fillers, there's risk of vascular compromise, vascular blockage, and they're problems that the insurance company have to face should there be a claim. Now, if a practitioner like me or you is using one of these and we're avoiding problems by carrying out vascular mapping, by carrying out guided injection, checking after treatment, if we're doing those things, we're making the risk to the patient far less. There needs to be research done to look at, the differences in treatments carried out by ultrasound injectors and those that don't use ultrasound. There may be a difference, but I think over time there'll be a noticeable difference in those that use ultrasound.
Well, I mean, I can see it where if you are regularly dissolving other people's works. I mean, if patients come to you, and I know that patients come to you as well, and I think that was one of the reasons why, again, why is it so important now? Is that, forget the insurance companies, because obviously that's it, but the bigger picture is that regulation is coming in, licensing is coming in, and if you're dissolving other people's work, how obviously you've got a lot of knowledge, you're confident in doing it, but having the tools to visualize where the problem is, surely that's going to make a difference.
Certainly is. Well, even tomorrow morning, I've got a patient that's had treatment elsewhere. She came for a consultation last week. Now, I did some scans with the ultrasound, found filler in places that they shouldn't have been, and she's basically wanting reversal of treatment based on what she's had. So I'm going to be using this tomorrow to do more assessments around her face, carrying out a lip dissolution treatment and some nose to mouth area dissolution. So this will help me to be able to find exactly where the filler is. I'll be able to dissolve it much more accurately than just guessing and using excessive amounts of prescription-only high hyaluronidase.
Just on that note, because I'm playing devil's advocate, you know, someone will basically say, well, hang on a second, guys, with hyaluronidase, it infiltrates through tissue anyway. So why does it make a difference that if you've got a drug like hyaluronidase that infiltrates through tissue and you know roughly where the problem is, why do you need ultrasound to visualize it?
Well, because in my experience of reading all the literature and seeing what other people are doing, you'll have seen Instagram lives where somebody's spent a day or 2 days or a week trying to dissolve a filler in somebody's nose or in the lips. And the volumes of hyaluronidase, the dissolving agent, is ridiculously high, and the higher dose that's used, the more problems you're likely to see. Definitely. So using guided ultrasound to actually assess the tissue, to target the dissolution, you're using far less hyaluronidase. Prescription-only medicine, there's no point using something excessively if you know what the problem is and exactly where it is. Why use material when there's no need for it?
Exactly. I'm in agreement. I was just playing devil's advocate to the point. But the point is that if you can, obviously it takes a little bit of experience, but I'm the same as you. So now before every patient, I will vascular map. So vascular map, for those of you who are patients watching, is where the vasculature is your arteries, your veins, and the ultrasound that both Viv and I have in clinic allows us to see blood flow. And it goes back to complications. You know, you might not necessarily cause a vascular occlusion, but you may, you might be presented with 2-3 days later where you've got a vascular compression. And again, you'd be like, well, I didn't see that when I was injecting. There's no chance that I aspirated, I checked, I did everything I could, but still this patient's presented with a suspected compression. And I don't want to be in that situation. So now I've got a piece of kit in clinic where I can see that if there's intermittent blood flow in an area, potentially, and then there's a definite object on visualization, that it could be that the filler's compressing. So if we said we'd keep it short so that we could get back to our lives, but so my view was that in terms of this series of talks, everyone who's watching, listening, is that we will carry on talking this month about why we chose ultrasound, kind of just repeating the message. So if there's anything that anyone wants us to talk about specifically, we can do, but we'll probably just be exploring a little bit more about maybe the Clarius itself, and how what is it that you want to, what should we focus on next week with, in terms of apart from
really, what we can start with the beginning, I suppose. We can treat it a bit like a story. We can start at the beginning, and we can say, like, what did we do when we first got the device? You know, what did we end up doing with it at the start?
Well, taking it out of the box first is a good start, isn't it?
Yeah, just setting it up. You know, things like what do you actually do when you get it? That was one of the difficulties when I first got mine. What do you actually do? With experience, you get to know exactly what you need to do, but it is a steep learning curve, and that's one of the things I found. It's not easy to start using an ultrasound scanner if you've had no experience previously. So I think maybe starting at the beginning, just basics, just to talk about
definitely
what the device is.
So our experience of taking out the box and what we did at first.
Yeah,
brilliant. Thanks, Viv. You're hosting. I'll let you have the last word.
No problem. Really nice to speak to you, Sunny. And as I say, we're going to do a series of lives every week, every Thursday evening for the next 5 or 6 weeks, I think. And if there's any topics anybody would like us to talk about in these lives, just message us and we're happy to discuss whatever's of interest. But I think, you know, if people are interested in this, in a device to make things safer for them and for the patient, and one of the other things is it can also be used to improve networking between practitioners within localities. If there's a problem locally, if a practitioner's on holiday and somebody in a local area may have a device, it wouldn't be that difficult to organise an out-of-hours service where one practitioner that uses a device should be available for all patients with a problem within a certain area. It's just something that could be looked at in future.
It's an interesting idea, Viv. When you say out-of-hours like that, it sends a shiver down my spine.
There's ways of organising it, but it's just one idea. That's something I thought about.
There's no out-of-hours in our business. It's all hours or nothing, basically. When your head hits the pillow, that's when
it's just at times like when you say on holiday and there's a patient that might have a problem, you're not around to look at a vascular compromise issue. If there was a practitioner locally that patient could go and see who had an ultrasound scanner, it would make life easier for everyone.
Yeah, that'll be the goal, that practitioners work and network, and that's what we do. I mean, you're in the north and I'm in the East Midlands. We're not in locality, but just sharing this information and what we've picked up with ultrasound so far. But I look forward to next week. So I'm hosting it next week.
Next week, 8:30 next Thursday, and we will talk about the beginnings of when we first got the device. I think that's probably the easiest thing to do.
Brilliant, Viv. Thanks very much.
Great. Okay, nice speaking to you, Sunny.
Cheers, mate. Bye-bye.
See ya.